There are so many amazing things happening in our community, and we love to highlight them. This one was just it just knocked my socks off. I saw it on Twitter, and this news this morning came from Henry Ford Hospital, West Bloomfield, where they have begun using, and I put my glasses on here to get all the details, begun using a new product called Gelolan. I think I got that right. It's a one-of-a-kind optical imaging agent that makes, as you can see in that picture there, it makes cancer turn up pink in the imaging. And I think I got all that right, but I don't know what the heck I'm talking about. Dr. Adam Robin, though, does from Henry Ford Hospital, West Bloomfield. And Dr. Robin is with us this morning. Thank you for joining us, sir, and welcome to The Splash.
Yeah, absolutely. It's a pleasure to be here. Thank you for inviting me.
So the setup, how close was that? Did I get any of that right?
I tend to call it Jello Land too every once in a while, but I think it's pronounced Gleolan, and that's actually the easy name for it. The actual name for the drug is 5-aminolevulonic acid, so you can see why we call it Gleolan.
Well, thanks for
Yeah.
making that a little bit simpler for the rest of us. So tell us about, I mean, we saw the pictures and we saw the pink and the imaging, but just tell us, if you will, Dr. Robin, why this makes such a big difference.
Well, I think, to understand that, first we have to understand what we're treating or what we're using it for. And I think you had it right on the money. It's an optical imaging agent. So, a lot of syllables, but really what it means is our patients that have high-grade brain tumors or brain cancer can come in for surgery, which is the first step in their treatment. And a few hours before surgery, all they do is have a drink. It's an oral solution. And once you drink it before surgery, it circulates around and then it gets preferentially taken up by the tumor cells, where it's converted into an agent that, if you shine a deep blue light on it in surgery with our microscope or with our loops, it'll shine bright fuchsia or pink. And these tumors, they tend to infiltrate into the surrounding brain, and sometimes they're not easily recognizable from normal brain tissue. And so this is a real game changer. It's cutting edge stuff. And as you can see in that picture, it shows up very easily, and it makes it much easier for us to take the tumors out. In the studies that they did for this 5-aminolevulonic acid, it doubled the rate of complete tumor resection, and it improved how well people were doing without any recurrent tumor 6 months after surgery. So that's one of the reasons we're delighted to bring it to West Bloomfield Hospital and to the patients in the area out there.
So, Dr. Robin, are you using that imaging tool live when you're in the middle of surgery, or is this something that you plan before and map it all out and then go to work?
Well, we do both. We have all kinds of fancy imaging technology, and we do a lot of planning before we even get to the operating room. But to your point, this is a live optical agent. So while we're taking the tumor out, we have either a microscope that's shining sort of a deep blue light onto the field, intermittently with our white light, or sometimes I have surgical loops attached to my head with a light around the top of my head and shining right into the field. And when you shine that deep blue light on the tissue in the brain while you're taking the tumor out, it just fluoresces, so you can tell if there's any remaining tissue after you've taken the bulk of the tumor out. And like I said, it's a game changer. Sometimes hospital systems have intraoperative MRI, so we can take out a tumor, we can get an MRI while the patient's still asleep in surgery. And this 5-ALA or Gleolan is the equivalent of having an intraoperative MRI handy, and it's much faster.
Dr. Adam Robin joining us from Henry Ford Hospital, West Bloomfield. He is a neurosurgeon and is using this new product in West Bloomfield to help identify tumors in the brain. I imagine when you are trying to remove a tumor, you don't want to take any more tissue out than you have to. And I assume this helps.
It helps quite a bit, especially in areas where we know there's critical function. So during surgery, we have a number of techniques that we use to make sure that we know right where all that critical function is and where it isn't. And it's also nice to have an agent like this that will tell us where the tumor is and where the tumor isn't. So we can be much more precise and we can maximize the amount of tumor that we can take out safely for patients. And really, the reason we want to do that is because that will then correlate with how well patients do after the operation with the additional treatments they get for tumors like these.
We really respect what happens in your hospital in West Bloomfield, but I don't really think about it, with all honesty, as a research hospital. But there's research and development going on everywhere. How new is this, and is this something that we're finally doing here that's been around, or are you on the cutting edge and still learning more about this new process?
Well, that's a good question. This research, the main research for this was done in Europe in the mid 2000s, and it's been approved out there since around that time. It's recently approved in the United States in around 2017 or 18, and we were one of the hospitals in Michigan that was doing the clinical trial work for some of those studies. It's not very often used outside of tertiary or quaternary care hospitals, and so it's a real game changer to be able to use this, in a community hospital out of West Bloomfield. But to your point, we are doing research. We are keeping track of how well these patients are doing, and even though this agent has now been used around 40,000 times, it's being used increasingly out at West Bloomfield Hospital. In fact, we just recently had a brain tumor case we used it on last week. So it's wonderful. The hospital at West Bloomfield, whether it's robotic surgery or fluorescence guided brain tumor surgery, really does have all the cutting edge technologies. And the staff there is really wonderful at adapting these new technologies for the benefits of our patients.
Well, Dr. Robin, I appreciate you joining us today. It's amazing what's going on in healthcare. Really one of the scariest pieces of news you can get from your physician is that you've got a brain tumor. That's not something that anybody wants to hear. But the care that you're able to give now has just leaped forward so much that this isn't necessarily going to be a fully debilitating kind of a result that you're going to have if you do have a brain tumor. There's no reason that it's the end of your life or the end of your function anymore, and it just sounds like you're making great accomplishments.
Well, I appreciate that. I think, every one of the techniques or technologies that we adapt, whether it's awake brain surgery or mapping out of critical function during surgery, or in this case, fluorescence guided brain tumor surgery, they all add to our ability to do better for patients. And sometimes progress is incremental. This is a big step in doing better for those patients, and the outcomes are proving that.
Well, I thought I asked every question I wanted to, but awake brain surgery, you got to tell me about that. So you're engaging in brain surgery with patients while they're awake.
Yeah, there are some functions that we can map while patients are asleep. We're actually quite good at doing that. But there's no substitute sometimes for being able to have a conversation with a patient or test other modalities while the patient's awake, when we know that there's a tumor residing in an area that's really critical for a particular function. And so in some cases, we'll use a combination of fluorescence guided surgery and doing surgery while awake to test for those functions. And again, it all comes back to the patient. This is so-called precision medicine, but it's being done from a surgical standpoint. We are testing each individual function that we can, so that we can save those types of function and quality of life. Aspects of quality of life for the patient. And then we're also using these optical imaging agents to maximize our ability to locate the tumor relative to that function, all to improve the quality of life for those patients and improve outcomes.
Well, Dr. Robin, thank you very much for taking a couple of minutes with us. You know your industry is the benchmark against all other skilled tasks in the world, because we say it every day. Hey, it isn't that hard. It ain't brain surgery. Well, you are engaged in brain surgery, and it's amazing what you're doing. Thank you for your skilled work right here in West Bloomfield, and so good to have you with us on the program today.
You're very welcome. Thanks for your time. I appreciate being here.